Hello, welcome back to M Training Solutions. Today shall be discussing the GIT motility conditions and antiflatulence. By GIT motility, I'm meaning the diarrhea, the constipation, and of course emesis or nausea and vomiting. Now, of course, we know that GIT motility is controlled by the enteric nervous system, autonomic nervous system, plus local unsaturating hormones, all regulating the tone of the GI smooth muscle. As I've said earlier, that the conditions include constipation, diarrhea, nausea and vomiting, and other functional conditions which I'll look at in other presentation, dyspepsia and all these. Now, constipation or laxative and laxatives. Now, of course, we know that constipation is a condition characterized by hardened feces or difficulty in emptying the bowels. Now, let me first define these two terms: a cathartic agent and laxative. Now, cathartic agent is a substance that accelerates defecation, whereas a laxative is a substance that eases defecation. They are almost the same, but they are a bit different. Now, how do we classify laxatives? Laxatives are classified according to their either they can be luminal active within the GIT, but like a bulk forming agent, osmotic agent, stool wetting agent, or emollients, and the stimulant laxatives. We have the bisacodyl, castor oil, and anthraquinone, which is a product of pharmacognosy, and the prokinetic agents such as the 5-HT4 receptor agonists, motility analogs, all these ones, dopamine receptor antagonists. Now, all these ones can be classified as laxative. However, the common ones which have in pharmacies, we have the bulk forming, osmotic, and the bisacodyl. Now, first in detail, let us look at the stool wetting agents and emollients. We have examples. We have glucosate sodium and glucosate calcium. These are the lower the surface tension of stool, allowing it mixing with aqueous or for the substance and softening it. Of course, by doing so, there is defecation or passing out of bowels. We have mineral oil. It penetrates and softens the stool and lubricates the stool. Of course, it may interfere with also the absorption of water. Of course, now the most side effect is diarrhea, because you want to cause diarrhea. Sometimes you can have some small pain. Now, stimulant laxatives, of course, these are the ones called the cathartic. We have bisacodyl, the stimulation of the intestinal motility, bisacodyl and diphenmethane, because the common one is bisacodyl. Others such as castor oil are also used to stimulate circulation of fluids from the lumen of the GIT, hence increasing passing of bowel. Others such as anthraquinones can also be used. You can search about those ones. Now, osmotic laxatives, these are also common. The lactulose, they stimulate the colonic propulsive motility by osmotically drawing water into the lumen. Lactulose is also common. Others such as PEG, polyethyl glycol, can also be used. Saline laxatives can also be used. They contain magnesium cations or phosphate anions. Of course, the cathartic action results from osmotic water retention within the GIT, which in turn stimulates peristalsis. Yes. Others such as magnesium hydroxide and sodium phosphate can also be used. Now, the prokinetic agents which can be used, we have procalopride can also be used. Procalopride. Also, the opioid receptor antagonists. Remember, one of the side effects of opioids is constipation. Now, we have methylnaltrexone can be used. It can inhibit the peripheral mu opioid receptors, and of course, once you inhibit them, you are leading to increased peristalsis and easing of passing of bowels. Others can also be used. And of course, after dispensing, when dispensing these medicines, ensure you tell the patients on the non-pharmacological management of constipation. Exercise, you know them. Exercise, increase fluid intake, increase fiber intake, and so on and so on. Because it's always important to tell the patient. Now, let us look at the increased motility or the diarrhea agents. Now, of course, diarrhea is not a disease, by the way. It's not a disease, but a symptom. And pharmacotherapy of diarrhea in adults should only be in patients with significant or persistent symptoms. So, diarrhea is not a disease, but a symptom. It is something which is causing it. Many of the agents act by decreasing motility, GIT motility, but however, they should be avoided in acute diarrhea. Because imagine you may give anti-diarrhea agents like Imodium when the patient has an irritation in the GIT. So it is good you let the patient diurete as you do fluid replacement, because that one will be clearing the intestine. That's why it is always important to not overuse the antidiarrheals, because there may be some cause of that diarrhea, and if you cause constipation by diarrhea, you may be making that agent stay in the system, which is of course a problem. Now, of course, the common antidiarrhea agents have loperamide, this an agonist at mu receptor, the agonist at MO receptor. Now, this one we shall look at it properly when we reach opioids, because we know that opioids cause constipation. Are you getting it? So now, loperamide is a weak opioid. It acts on those receptors, causing constipation. Of course, decreasing GIT motility. Of course, it doesn't cross the blood-brain barrier, and there's no potential for addiction. Other agents, we have diphenolxylate, which is also an opioid agonist, peripheral opioid agonist. Now, other agents which can be used, we have the bile salt binding agents. This one we looked at them, I think in which presentation? Antilipidemics. Antilipidemics. We looked at them. Now, they also can have the bulk forming agents. The carboxy, methylcellulose, and calcium polycarboxyl. Now, however, we also have fluid replacement. This is also used, the ORS and DAROS, in conjunction with zinc. Now, ensure you know why we use ORS and why sometimes we use DAROS solution, and why we give zinc tablets to these children who are diuretic. Now, what I'm not talking about is the antibiotics which can be used in management of diarrhea. But sometimes you have traveler's diarrhea, where you go to a location and you get diarrhea, and you need to talk about, you need to take these antibiotics. And again, in gardiasis, which we shall look at later on in protozoa, where we use the metronidazole and others. Antibiotics can also be used in management of diarrhea, and also charcoal. So, however, I want to explain the examples here for antibiotics, because we don't want to I don't want to say that in every diarrhea you give antibiotics, because most of the children, the diarrhea in children is caused by viruses. Now, let us look at briefly